It's 2026. Is HIV still a thing?
Find out today on Medical History Mysteries.
Hello, everybody, and welcome to Medical History Mysteries, another week of fun-filled information entertainment brought to you by me and Tom.
Love it.
Oh my goodness. So this is interesting. This week, I wanted to talk about HIV, AIDS, and these series of drugs that people call PrEP. I see the commercials for them, and it sounds like if you take it, you can sort of have a free-for-all in life. But I don't know. I don't think things are ever that easy.
I have seen HIV from the very beginning. I just happened to pick, I guess, the right 30 years to be involved in medicine. So right around the time I was getting started, it was the 80s, and HIV was the biggest thing ever in medicine, and rightfully so because of all the poor people that died from HIV infection. Even before we really knew a lot about HIV, it was, in my opinion, one of the most scary things you could think about. And again, because we didn't know what we didn't know. The other problem with HIV is the fact that it mutates so easily. What happens over time is, even though you're stable on a cocktail of medications, over the course of time, if the virus mutates and changes, you've got to change your medication along with it. We didn't know that as well in the beginning, so that led to a lot of people passing away, unfortunately, as well. But it's been 40 years, 50 years almost, Pam. So it's been a long time now. And I think we've seen almost every variation of HIV that could possibly be. Like, we've gone through all the permutations. And so the move has been now to prevent HIV infection if you want to have unprotected sex with multiple partners, or even your own partner, your partner who happens maybe. So you're like one partner, but your partner likes to be with other partners. So how do you prevent HIV? How do you prevent the infection itself? So PrEP, or what they call pre-exposure prophylaxis, is what we've just discovered is a very highly effective way to prevent HIV infection in people who are HIV negative. Up to 99% in people who have unprotected sex, and I think it's up to like 75% in people who are sharing needles and other injection drug use. No question, it's recommended for those people at higher risk, especially those people who are HIV positive, who have partners who are HIV positive, who are non-monogamous relationships. And most insurance does cover it. I think the biggest problem is understanding which drugs people use for PrEP, and one of them is Truvada. So Truvada is a drug that people use for two things. They use it for PrEP, but they also use it to treat HIV. And so that becomes the problem in my mind. You're taking a medical history, patients indicates they're taking Truvada, you're going to have to ask them, you know, do you take it as PrEP or do you take it as a treatment? Because on the one hand, maybe they don't have HIV and they're just trying to prevent, getting HIV. But on the other hand, they may have HIV already, and now you need to wear, of course, we all wear our protective equipment anyway, but I'm just saying you've got to take more precautions. Ultimately, one of the reasons I like PrEP is, again, because it's prophylactic, but also because it does require a medical checkup every 3 months. And so that does get people to see their doctor more and more. And I think ultimately it's good for everyone, as long as you don't mind the side effects, which sometimes can be egregious.
Okay, so you mentioned Truvada. Are there other drugs that we might hear that are going to tip us off that it's used for PrEP?
So there's Descovy, but it's not approved for cisgender women. And there's Apretude, which is a long-acting, every other month injectable. Again, not very common. Truvada seems to be the drug that most people take because it's easier, because it's the insurance companies covered, because it's less expensive. And let's face it, anyone can take it. Anyone who's HIV negative, who has unprotected sex, who doesn't want to wear a condom or something like that. For them, it's a viable form of, keeping themselves from getting HIV, but at the same time, not using contraceptives that they don't find necessarily, that fits their lifestyle. I mean, not everybody likes condoms. Not everybody likes, the using condoms, and even then, condoms aren't 100% effective. So in some people's minds, well, why not use PrEP? Because, you know, PrEP with a condom or even PrEP without a condom, at least I'm as protected as I can be.
I like that you mentioned as you're taking the medical history to say, is this a preventive or is this a form of treatment? How else can we have this conversation and bring it up sensitively? Because it's not the most comfortable topic for the patient or for the provider.
I like open-ended questions. I like, I think people prefer non-judgmental, non-confrontational discussions. And I think the one way we do it, the way I've done it when I've taken medical histories from patients, is I'll just read the name of the drug to them. I realize in dentistry we don't like doors. I don't know what it is. Medical offices have little rooms with little doors. We don't do this in dentistry for some reason. So if you say out loud, "Oh, I see you're taking Truvada," and you're talking to the patient in operatory 2, the patient in operatory 6 is like, "Yeah, me too." So I realize that there's less privacy, so I tend to keep my voice down anyway. But I'll say, okay, I see you taking Truvada. Tell me about it. And I just leave it open for them to talk, right? So they don't feel like I'm judging in any way. I'm just asking. So you're taking Truvada. Tell me about it. And then I'll get the answer. Well, I take it for PrEP. Well, that means you don't take it every day. No. Okay. And at the same time, why not? Why wouldn't you take it every day? Do you plan intimacy? Is that a reliable way to take what did your doctor have to say about that? As far as your ability to take PrEP every day, or whenever you think the time is right. But they may say, no, I take it because I have HIV infection and it's doing a really good job in keeping my levels low. Great. And so I'll just move on from there. But I'm always asking the patient the three questions. And I know you've heard me say a million times, what do you take and why do you take it? Because I'm pretending like I don't know. They think I know, but I'm really asking them why, because I don't know why they're taking it. And then, of course, the most important question is, did you take it today? Right? And so that's going to tell me a lot about the patient, and it's going to allow me to treatment plan, right? If it's PrEP, I'm not going to be so worried about, infection. If they've got active HIV, well, I'm going to be a little more cautious in the way I handle needles and instruments and so on.
You also mentioned side effects. Would you talk about that?
It's not for everybody. Uh, there are GI side effects to HIV medications. Not many people can tolerate. Truvada seems to cause the least, which is why I think it's the most popular. And HIV medications are very prone to drug interactions with other drugs and other supplements. So you take PrEP and you don't realize that even, St. John's wort can interfere with your HIV meds, in this case your PrEP, and make it less effective or increase the side effects. So I'm always concerned that people don't look at Truvada as a drug they take, but a drug they take to prevent their infection because they want to have unprotected sex. So it's almost not, and I don't mean to imply that they are, but in some people's minds, it's like a contraceptive. You know, I'll take it before I have sex. Well, we don't do that with all contraceptives, right? We take it every day, obviously. And so why wouldn't you take your PrEP every day? Well, side effects. So that's why I want to make sure they've had that conversation with their physician to know, when they should take it, when they should not take it, and what side effects and what drug interactions could exist. We're not always experts in drug interactions. I know one of the drugs that we use in dentistry that can affect HIV medications is diflucan, which we use for candidiasis. Well, candidiasis is sometimes something that as a result of having oral sex or so on. So you can see how that could easily become an issue. And I want to make sure that I'm asking those questions about the drugs that the patient takes. But when I find, for example, candidiasis, either oral candidiasis or fungal pharyngitis, then I know enough as the hygienist to tell my doc, hey, they're also taking PrEP, so maybe we should prescribe nystatin or miconazole troches instead. Or, again, if the doc's opinion, fluconazole is the way to go, so be it. But I want to be knowledgeable enough about the patient's medical history, but also be a source of knowledge for the dentist in this situation. Because, if I'm the hygienist, I've got more time with the patient. The docs, kind of run in and out, in and out. That's important information for that doc to know at that time.
Are there other interactions we should be aware of regarding antibiotics, analgesics, or anesthetics?
There's so many interactions. Luckily, they don't really impact the drugs we use in dentistry, but they do impact the drugs that people use to treat other medical conditions. And while it's not our place necessarily, because, we are at the end of the day dental practitioners, I think it's worth, if you've got the software in your office and you've got the ability to access it, I think it's sometimes important if you've got the time to run some drug interaction checks on the drugs that the patient's taking, especially if they're younger that may not be taking as many drugs, but they are taking PrEP. I'd want to know if they're taking certain drugs that are used to treat epilepsy or certain, as I said, dietary supplements that interfere with the cytochrome P450 enzyme systems because I want to be able to maybe give them a piece of advice like, hey, did you talk to your doctor about taking St. John's wort with this? Because there's an interaction between these two, and I think your doctor may want to know that. And that's the value that we add to every experience with a patient in dentistry. Because as I've said 1,000 times, right, we save lives in dentistry, right? We save lives because we save people from themselves.
Incredible. Well, this was interesting because I think that we're going to see more and more of these medications popping up amongst our patients, and having this conversation in a sensitive way and an effective manner could really help them.
Let's just make sure one more thing, Pam, that when we talk to our patients about PrEP, that we understand and they understand that while it prevents them from maybe getting HIV, it is not a contraceptive, right? So the pregnancy is still a possibility. And I think while that seems somewhat, academic to us, that may not be apparent to everybody who uses PrEP. So that's one more thing you can add to the arsenal.
Awesome. And also, it doesn't protect against other STIs.
STDs. Yeah, exactly right. Yes.
Exactly. All right, everybody. Well, thank you so much for joining us this week. I hope this gave you a little food for thought as you see your patients. I know it certainly does for me. And I can't wait to see you all next week.
See you, everybody. Take care.